It's very interesting. We'll do one more minute and then we can just go ahead and get started. All right, 5:05 on the dot. Let's get started. So, hello everyone. I'm Jacob Woods. I'm the marketing lead for Hack Ohio, and I've asked Madison to come in and give us a talk kind of about COVID-19 response in the community. She is the CEO of Point, and Point is a collaborative volunteer app that actually helps bring volunteers and other kind of free tech and stuff like that into nonprofits. So yeah, Madison, I will give you control and we can get started. Thank you for coming.
Thanks for having me.
Okay, are you able to share your screen?
I am.
Awesome.
Give me one sec to frame up my screen.
Yep, it's looking good. I think I can see it on my end.
All right. Oops. Grab something else. It's supposed to be there. Well, thanks, Jacob, for having me. I love talking to people like you guys that are creative thinkers about massive problems in the community, and I hope that at the end of this, you'll be able to take some of these massive issues and think about how you could essentially hack your way into solving some of these massive issues. But first, you have to understand what those issues are. So I want to tell you a little bit about what the heck has been happening in Columbus from a human standpoint, really. And I phrase it as really the nonprofit response in Columbus. We're not going to talk about businesses. We're not going to talk about restaurants. Hopefully you guys are really aware as what has been happening in that space. And I'm sorry, I'm totally falling over my words today, but the stutter's probably going to stay. But a little bit about me. My name is Madison Mikhail. I am the founder and CEO of Point. And what Point is it's a platform for, most people know as an app like ClassPass for volunteering. And what that means is that you can download our app, and I really hope you do, that allows you to volunteer with nonprofits in the community. We work with a little over 300 nonprofits, and we have a little over 15,000 users. And that's not all what we do. Our core mission as a company is to actually give nonprofits free tech. And what we discovered is that when we launched Point, the app, nonprofits were like, this is really great data, but we don't have great ways to manage it. Most of the time, nonprofits, especially local nonprofits, operate off pen and paper and Google Sheets and literally abysmal ways to operate personnel for your business or for your mission, or they're paying $10,000+ on software systems like Blackbaud to come in and manage their volunteers for them. So we thought, why isn't there a way for this to be free? So what we do is we have a social enterprise model where companies subscribe to Point and they buy our software to manage their corporate social responsibility programs, and then we gift the software to nonprofits for free. Call it our buy-give model. It's kind of like Tom's Shoes for Tech. So companies buy the software, they gift it to nonprofits, and that's who we are. So hopefully that gives you a good context of who we work with. Again, because we work with so many nonprofits, we were able to really understand what the impact of COVID was on the nonprofit space, and for us, a lot of that impact came in early February as COVID hadn't really hit, but we were seeing the effects and the worry from China all the way over to the US. So just to start at the basic impact of COVID, it's important to talk about the death toll and the case toll. And I think during COVID, what we have forgotten is that it's affecting everyone, yes, but it really, really affects some families. And that means that almost 5,000 people in Ohio have lost someone in their family. And in Franklin County alone, not including all of Columbus, we've had 600 deaths. And how does that compare into, past historical events? Ohio during the Vietnam War, we've surpassed the death toll of soldiers and casualties who died in Vietnam. If you look at the 1918 flu epidemic or Spanish flu, in all of Columbus, we lost 800 people, 817. And in COVID, we've lost, in Franklin County alone, 600 deaths. So I'm sure that if you total the deaths, we're right at the epidemic death toll of 1918. This is historic. It's historic for our community, and it's really a time where not only is there's death and there's implications, but there's a lot of underlying impact of COVID. And this is what we're going to talk when we talk about the nonprofit sector, because the nonprofit sector has everything to do with human related support. And we have mental health and isolation issues. We have unemployment rising, which you all know. But as unemployment rises, hunger rises, which is one of the largest issues right now and will remain one of the largest issues moving forward. Because of unemployment or work from home, we have lack of childcare because of social distancing measures, and that often puts the most pressure on women. So now we have a women in business issue. Women are losing their jobs at higher rates than men, or they're stepping out of the workforce voluntarily to take care of their families. We have racial injustice as COVID affects Black and Brown communities more than white communities, whether that is the virus or access to medical care. And we have loss of programmatic support, which just means nonprofits aren't functioning. And this is just a short list, right? There are lots of problems happening in the city of Columbus, but these are the high level ones. And to talk first, I'm just going to dive right into hunger, because I think that most of us don't understand and have the privilege of not understanding how hungry our community is. And these statistics actually came out on September 18th. And it's one of the first studies that has come out about COVID-related hunger overall. Right now, 29 million adults report that their household sometimes or often does not have enough to eat in the last 7 days. That's 21% of all US adults, but that's an average. That's really 21% of Black and Latino respondents, and 8% for white respondents. So we have a hunger issue in the US. Over 1 in 5 Black and Latino adults saying their family are going hungry in the US during COVID. This is a massive, massive issue. And because the study is just conducted right now, we understand that the problems that were in March and April and May at the height of our social distancing issues were also not really taken into account. So we now are at more of a stable economic business practice really in our country right now. People are going back to work, we understand the rhythm, and we still have 1 in 5 Black and Latino 21% of Black and Latino adults reporting that their families are going hungry. So at our basic human needs, we're having massive issues. And who fills those basic human needs? Nonprofits. And when we look at what's happening in nonprofits, we have another issue. 83%, we're just talking here in Ohio. 83% of all Central Ohio health and human services nonprofits experience revenue loss. That revenue loss in Columbus, it's expected to be $8 million lost in nonprofit revenue. Nonprofits need creative ways to make money. They've lost their fundraisers, they've lost a lot of donations, Corporations are stepping back sometimes in their large corporate donations because their budgets are getting cut. Individuals are not giving us more. Their social enterprises, meaning the way that they make money through business, through the nonprofits, have been cut. And this leaves us with massive problems and leaves us with nonprofits having to lay off staff. And more importantly, and actually equally as important, they are unable to impact, or they're unable to perform the programs. So 80%, I'm just going to read this, of nearly all Central Ohio Health and Human Service programs are suspended or have limited operations as of April 2020. That is a major issue. Our programs for nonprofits, meeting the basic needs of our community, are being cut. And those basic needs are absolutely vital. And we'll go into what those programs look like. When it comes to food and programmatic support for housing support or anything like that, again, the most fundamental issues, those programs are still operating. Then we'll get into the next level of problems in those issues. But look at all the other different programs that nonprofits have stopped providing: after school programs, mentorship, financial literacy, legal services, even hot meal services. Most people are not doing anything hot, childcare, job training. This was only counted of 50 nonprofits. The survey is now well over 80. I think approaching 90 of our nonprofits. We have thousands of nonprofits in Columbus, and some of those nonprofits that didn't even respond to the survey has shut down completely. So now we have this major gap. Our community is hurting more now than ever, and historically is on track to some of these major historic events that have happened in our state, in our history this past, and now we don't have the programs to help people. Not only do we not have programs to help people, but the basic human needs, fundamental services, again, like food pantry assistance or housing support, don't have enough volunteers. So this is where Point comes in. And I hope that you'll really sit on some of these other issues that Point doesn't address. For you guys, your minds start going through and saying, how can we help? Because nonprofits need the help. They need an outside point of view. They would probably take people coming in to help. And you can help in a number of ways. If you have technical skills, you can join Can't Stop Columbus, which is an organization of hundreds of people from the tech community in Columbus that come in and give their skills to different projects and programs that you can join. And if you have an idea, you can actually bring your idea in and gather people on your team to help you. So think about this, do something about it. But for me specifically, our focus during COVID is how do we assist the nonprofits that are still functioning, because only 20% of nonprofit programs are functioning at this time, and how do we get them enough people to help? And as dramatic as it sounds, we had a volunteer shortage nationwide. I'm not kidding you. The New York Times, Washington Post, everyone in between is reporting during the height of COVID how demands were increasing, but there was not enough volunteers to be found. And that is a complicated issue. And we'll take food programs just as an example. Food programs in the U.S. Are run by volunteers. 51% of food programs in the U.S. are run entirely off of volunteers. And those volunteers happen to be, more often than not, over the age of 65. Retirees who volunteer 3 to 5 days a week. And because of COVID, those individuals are still at risk for COVID. And nonprofits no longer have a way to recruit younger volunteers. Nonprofits normally recruit volunteers through word of mouth, through outdated websites that would drive most of people on this call absolutely insane. And they lacked a way to find volunteers. And this is where Point comes in. Point is built for younger people to go volunteer. Our nonprofits were basically thrust into the future. Nonprofits didn't know how to use Zoom, the majority didn't know how to use Zoom before COVID. They didn't have any of their operations online before COVID. They, again, were recruiting volunteers through word of mouth, and again, some of them operate off of pen and paper. So we have a really antiquated system that had to adjust rapidly to 2020. And, for some of that meant building a website that was functional. Some of them didn't even have that. So we're talking about a major technical crisis. And for Point, we thought, how do we get enough volunteers to help in Ohio? Point operates right now slightly in Cleveland, Cincinnati, Columbus, Austin, Texas, and launching in Denver. And what we discovered in Ohio very quickly is that our food banks, food pantries needed absolute emergency volunteers. We did campaigns, we did everything in between. If you saw our ads during June and were bombarded by our videos, I hope you went and volunteered. We had almost 250,000 people see that content in Columbus. And it was really a joint effort of the state to come together and find volunteers. Our volunteer engagement increased by 4%, or it increased or quadrupled. Can't talk. Went up by 4%. No, it quadrupled for us to match the right people. And then we had Governor DeWine making really smart decisions, and he stationed about 300 National Guard members almost permanently for about 4 to 5 months at food banks and food kitchens. And what that means is that we, as a state, didn't have enough people volunteering. And we literally had to send the National Guard to go be volunteers. It's a little pathetic. I wish that our cities and our state understood and empathized with basic human needs enough that we would go and volunteer. But you know what? It's an educational issue. And the educational issue was that a lot of people didn't know that the problem existed, 1, or 2, didn't know that you could actually go and volunteer with a stay-at-home order, which you could. So even though the government was telling you stay at home, there's a clause in that stay-at-home order that says unless you're volunteering for basic human needs, essentially. So all of these issues are happening at once, increasing our capacity, trying to find volunteers, trying to educate people to come volunteer, but also as you start to launch and produce technical products, Apple and Google always throw something your way. And for us, as an app that encouraged people to go do something in person during COVID, we had to follow Apple and Google's COVID precautions and mandatory guidelines. And what that meant is we actually had to get permission from the cities and the states that we operate in to give us letters from the public health department saying that we actually could operate. And not only that, but we had the institute a sorting mechanism so that we would actually find low-risk volunteers. So if you log into Point, if you say how to help during COVID-19, we're going to ask you to take this quiz to see if you are actually a low-risk volunteer and people in your household won't be affected, and those guidelines are established by the CDC. So you think when you start out with a company that you're just going to develop something and put it into the universe, and then all you're going to have to do is sit behind a computer and that's all you're going to have to do. It's not the case. You're going to have to sometimes, for us, get into government issues and run around trying to get letters signed from individuals. It was an absolute insane process. But a little bit about our impact during COVID. We brought on 5 times as many nonprofits as we had in the past. And we saw significant impact in those nonprofits. All People's Fresh Market is an initiative from Community Development for All People in Parsons, pretty near Capitol. And they need volunteers pretty much every single day of the week. They feed 400 families a day. And they needed 3 times the number of volunteers because their family needs kept on skyrocketing. Point saved their volunteer manager 15 hours per week on their volunteer management. That means that she was getting outside of her desk 2 days a week. Yeah, Jacob.
Sorry, that was me. I was messing around. That's my bad.
Well, I listened, but that's really the end of the story here is that there's a lot of ways that you can do some good with your technical skills in the communities right now. Nonprofits need you. They need people to think innovatively, and they need the help with tech. Whether that's literally building a website for a nonprofit, or that's tackling larger issues in the community, put your mind to it. This is the definite time that nonprofits need the support. And that's all.
Wow, that was great. Thank you so much for giving that that overview. You know, I never really understood the the crisis that you were talking about with the volunteer shortage and all that. And I was just I have one question about just how you guys did your marketing campaign to recruit more people.
Yeah.
I was just kind of interested in how you went about that process, and how you got people to actually sign up. I mean, with me being the marketing lead, we're always looking for new ways to get people to join. So yeah, I think that'd be pretty interesting to get your feedback on.
We've never done a B2C campaign before. And what we really wanted to do was grab people's attention from the get-go. So we partnered with a video firm, and we created what we thought were kind of eye-catching videos. And what I believe in the nonprofit space, and this is nothing to do with tech, but I really think that nonprofit marketing sucks. I think it's really guilt-ridden, and everything is like a sob story. And we were like, if we kind of make this essentially humorous, we might be able to grab people's attention that would normally scroll past. So we just did an Instagram and Facebook marketing campaign. We put a lot of dollars behind it. We were funded by the Columbus Foundation to do that. And, the videos worked. Also, we did a lot of direct outreach, which was essentially very painful.
Yeah, I bet. Yeah, I know, especially with COVID-19 and everyone being online, it's been an issue getting people to participate and get involved with that sort of thing. So I think
it is.
Yeah, what you guys did was great. If you got a 400% increase, that's awesome.
Thank you. And right now, our growth rate, our average monthly growth rate has been doubled since the start of COVID. So we were growing organically about 500 users per month. We grow now organically about 1,000 users per month. And that's not a huge growth rate in the tech world. But for us, getting people to go spend their spare time somewhere to do good, we're pretty happy with that. Of course, everybody wants higher growth rates, but it's a problem. It's hard. It's hard to get people to use your product, especially when you're asking something of them and not necessarily in the first impression of your product giving something to them. I think volunteering gives a lot to you as a person. I think it's really good for your mental health and getting outside your head, but people don't always view it that way.
Yeah. So do you have any like a website you'd want people to go and visit? I know I've been all over your main website and your COVID site. Like, that's really cool. I've actually taken the quiz, and it's simple, really easy.
Yeah, you can go to pointapp.org, or you can go to overcovid.pointapp.org. Overcovid is our campaign website, or you could just download our app and volunteer directly. I'm telling you, like, if you're in Columbus, Ohio right now, there are a lot of food programs that are still looking for help. There are literacy programs that are looking for help right now, and they are drastically underattended with volunteers. And I know that sometimes in our days we're like, I really want to put my mind to use. Why would I have to go distribute food? And it's an all hands on deck emergency situation. If it was a normal year, I would say, you know what? Yeah, do the things that you really want to do. Right now, I think you should do what your community needs of you. And sometimes that's just helping, get shit done. And that's with basic human needs: food, water, and access to healthcare.
Yeah, yep, definitely. That's just, I don't know, that just blows me away. I never realized. So I thank you so much for giving that talk. Let's see, does anyone have any questions they'd like to put in the chat or anything? I'm monitoring. I don't quite see any Q&A yet.
I hope that all made sense. I was kind of stumbling through it.
No, I mean, I have my notes. I think it was really good. But yeah, let's see. So like when you're going through and promoting like so like what's like the handshake between you and a nonprofit? Like do you approach them? Do they approach you? And like, I'm just interested in what the whole process is and like how that all goes.
It can be outbound or inbound. Nonprofits sign up for a point like they would sign up for any other system, like whether that's Facebook, if they're making a Facebook page, or Twitter, and that's how they sign up for point. So it's very much like signing up for a regular product. And what they understand about point is that we do help them with the recruiting process by encouraging people to download the app. We don't necessarily recruit for an individual nonprofit, so it's not like we're going to go be championing one nonprofit or one event over another. We essentially say, like, if you want to help locally, here's how to do it. This is your starting point, unintended.
Okay, great. Well, I think that answers all my questions. Yeah, let me check the chat. Anyone got anything up right now?
No questions?
No questions?
At all?
Man.
It means that was comprehensive, or?
Yeah, it means I guess you were doing the best presentation ever.
Yeah. For sure.
So besides like Facebook and the Instagram ads, how are you recruiting, I guess, younger? I know you were talking about most of the volunteers before COVID were over 65. So now you have to bring in a whole new demographic. Have you seen like a major increase of college age kids, or like how would you get involved with the college kids, the youngins?
It's hard to get young people to download something or to do something. But for us, we've normally gone the B2C route. We find companies or groups that have large numbers of younger people, and then we partner with those entities. So then we're able to drive a lot more users than the B2C model. And if you're developing a product like this, I highly recommend that. Partnerships drive large groups of people, which you would spend your effort, the same amount of effort, convincing one person to use your product as that one person who controls maybe 500 people. So I think for user acquisition, it's pretty important to think strategically.
Great, thank you. Looks like Ben turned on his camera. Ben, do you have any questions for Madison before we finish up? I think you're muted right now. Let's see.
Yeah, I am. Sorry, the stream just crashed on my laptop. I'm not actually sure if mine went through, but I was going to ask how the point team went about like finding new members.
New members of our team?
Yeah.
So our development team is pretty much set now. We have a team of 10 in total, about 7 developers, whether that includes QA, back-end, front-end. And then in terms of outreach, we only have one other person. Her name's Steph. She's our head of outreach and partnerships, and then me, and a comm person. We do take members of what we call a launch team, which are people in new cities that kind of reach out to the community preemptively to say, hey, we really want Point to come to our city, and they make connections for us. If you would like to intern with us, especially for QA, we do take QA interns. because you can never have enough people testing your product.
Of course. Thank you so much.
You're welcome.
Great. Anything else? We've got some pretty good questions so far. I'm looking. Well, I think that's all for me at least. Madison, I really want to thank you. That was really informative, and I keep saying it, but it's blown me away how I just never even really thought about it. And I personally didn't get any of the ads, but this talk has really kind of shown a new light on the whole COVID-19 crisis. So
yeah.
It's really I'm definitely going to start volunteering more and offering stuff. I think this was a great call to action, and for people who haven't attended, I think it'd be great to post this on our website and kind of have a little call to action page with this on there, if that's okay with you.
Sure, it's me stumbling over my words, but go ahead.
No, it was good.
I just think that what's important for you guys is that, use your hands right now, use your body, like get out into the community, help with those basic needs, but also use your mind and use your skills. And if that means joining Can't Stop Columbus and helping with more technical needs of nonprofits, please join. And just keep thinking. This problem is not going to go away. And just remember, we're living through historic times. 1918 to now, the impact is relatively the same. And I think this is a time in our lives that we're either going to sit back and say, I did something during this time, or, I didn't have to do anything at this time because I didn't personally feel it. And I think that's the issue here, right? Sometimes we don't personally feel these issues, and we're able to ignore them. And I think that we have an amazing opportunity in our lifetime that you can look back and say that you did something. And I think it's really an extraordinary time.
Yep. It's always, I'm always every day a little overwhelmed by it, but
yeah, it is. It's overwhelming, but again, you just start with something small. Do something. And for me, sometimes I look at my computer and I'm just like, oh my gosh, I can't even get started with the day. But you just got to start somewhere and just check at it.
Yeah, one step at a time. And
yeah, don't look at the whole elephant. Just start with the foot.
That's great. Well, I'm checking one more time. And if there's nothing else, again, thank you so much.
You're welcome.
Oh,
I would love to have you volunteer 3 Point.
Yeah, I'm like I said, I'm gonna talk with Web Team. I know Ben's on Web Team, and maybe get kind of a little call to action page at the bottom of our screen or something, so that we can maybe direct it over to you and Can't Stop Columbus and stuff like that, because we obviously really need some help in Columbus and Ohio. So
yeah, absolutely. Well, I'd love to have you all.
Great.
It's great to meet you.
Yeah, it was great to meet you in person too.
Yeah, hope to see you out.
Zoom.
Yeah, it's all right, stay safe.
Nice.
Thank you so much. Bye.
Bye.
Bye. Thank you. Stop recording.